your emergency?
A life-saving number to call when you are in dire need of emergency services. And it can be overwhelmed sometimes by those who are frequent callers. Most of these people don't realize how often they call for emergency services. They are often alone, scared, elderly, frail, or have mental health issues that drive them to call 911 over and over again. The West Allis Fire Department has a program to address the needs of these people. It's the Mobile Integrated Healthcare Program. It's designed to help people who lack connection to a primary healthcare provider or have social and mental health needs, and then reduce their dependence on the emergency 911 system.
The mobile healthcare program originated really back in the late 1990s when the National Highway Traffic Safety Administration published a document called the EMS Agenda for the Future Implementation Guide. And what it did is it identified that EMS could do much more for their patients. It wasn't about always taking the patient to the emergency department. For the last couple of years, we've been meeting with some of our medical partners in the community and having discussions and discussing the fact that we can provide better care for our patients by taking them to alternative locations, not necessarily the emergency department all the time. Oftentimes the health care they need can be better provided at a medical home like their primary care physician's office, not to the emergency department. We love the concept, we know there's a lot to it, and so we traveled down to Texas where they've got some very well-developed mobile integrated healthcare programs. And once we got down there, it just reaffirmed that we're on the right path here. We got a good program. We just need to develop it for our community to see how we can best serve our residents and our citizens.
The Mobile Integrated Healthcare Program has three main principles: educate, navigate, and advocate.
The three elements of the program are to educate, navigate, and advocate for the patient. The educational piece is to sit down with the patient, make sure they totally understand what their healthcare needs are, and make sure that they're connected with a physician. Make sure that they're taking their prescriptions as they need to. And then the navigational piece is to assure the patient knows where they can go to get the best healthcare, the most cost-effective healthcare, and not necessarily go back to the emergency department over and over again to get that care. And then finally, the advocate. And that's, we sit down and we connect all the healthcare providers together to make sure we're all working in concert to provide the best care for the patient.
When we first meet with the patient, we find out who's involved in their care. We want to get the patient into a medical home, which is usually their primary care physician. We connect up with all of the partners that are involved in the patient's care, and we try and develop a common plan for that patient's care.
The focus is on the patients, their needs, getting them better health care, connecting them to a primary provider who will know them and what they need, as opposed to going to the ER all the time.
So a normal 911 call, what happens is a person ends up having a medical emergency, calls 911, the paramedic shows up. What we find is that the person has had some kind of deficiency of taking care of themselves for whatever medical need it is. So the paramedics come there, they stabilize, transport that person to the hospital. Once they get to the hospital, they'll kind of do a long-term care for them, a couple days, give them some medications, give them some new directives, and then send them home. At this point, the person doesn't understand the medications, they don't continue with the proper care, their conditions progress, and they call 911 again. And the system just kind of goes in a cycle and a cycle. It's kind of the cycle that's been going on since EMS probably has really started. So what mobile healthcare does is we kind of stop that cycle. We get to that house before that medical emergency becomes a 911 call. We're there to kind of educate them, navigate them, and then take them to the proper resource at that point.
Visiting patients on a daily basis or weekly basis even versus only seeing them during 911 calls, we actually are able to understand the patient's medical condition, understand who the patient actually is, where they're coming from, what sort of medical care they're being provided. We're able to advocate for the patient. We found that some patients don't have a primary doctor, which is obviously a problem. They're just using the 911 system in the hospitals as their doctor. So we're able to get them into a primary doctor, allow them to establish a relationship with that person and get the care that they need.
Well, most of the time I was housebound and alone and always wondering what I'd do if something happened. And now it's so much different. I mean, the fire department is like family and friends, and my helpers come over and we all talk to each other and they explain what they're doing here. And my friends will talk about themselves. And they've helped me get equipment for the house, fire alarm, and they're helping me get a walker with a seat on it, and just a lot of screwing the light bulbs that burnt out, a lot of different things.
The program also has benefit to the community as it reduces healthcare costs and helps improve the health of the community.
By improving the quality of care, we have increased patient satisfaction. In addition, we have fire department resources that are more available for the community, and decreasing that quantity of care increases the quality for the entire community.
Ultimately, the goal is to graduate the patients from the Mobile Integrated Healthcare Program so they're able to manage their own healthcare.
At the end of our program, we determine whether the patient is eligible and fit criteria for graduation. If they have a primary care doctor, if they're taking their medications as prescribed, if they've reduced their emergency room visit utilization, then we will move them to a graduated status. Tiffany, on behalf of the West Allis Fire Department, I want to thank you for participating in our Mobile Integrated Healthcare Program and congratulate you on your successfully completing the program.
Thank you very much. That's great, thank you. And when they came into my life, things have changed, more positive. They gave me a lot of confidence, knowing that I'm going to be okay, and to stay out of the emergency rooms and stop calling 911 so much, and try to go to my doctor's appointments and things like that. And my future, it's going to be bright, I think.
Well, it's more peace of mind. I don't worry about, whether my meds are working or whether they're not working, because they're in every week. Check my blood pressure and my pulse, and everything seems to be running on a more even basis. And went in to see the doctor the day before yesterday, and he's downgrading one of my meds from 20 milligrams to 10 milligrams. That's all. I don't have the hypertension because I know I'm doing okay because they're checking everything.
I feel a lot safer. I feel like I know more people, and that I would know what to do if something did happen. And if I have a problem, I can always call them. And they come once a week, and if something does happen, I know it can wait a week. It's just entirely different now. I'm a happier person because I have the visits to look forward to.
And improving the healthcare and quality of life for these patients. That's what the Mobile Integrated Healthcare Program is all about.